Good morning, class. This is Miss McClendon, and I'm going to show you how I want you to do your vital signs on Monday. First thing you're going to do is put BSI. Remember, before you do any skill, you're always going to put body substance isolation and personal protective equipment. So I'm going to put my gloves on. Then I'm going to find my pulses. So the first thing I'm going to do, actually, before I'm going to do that, I'm going to do that first, okay? So first I'm going to locate my radial pulse, which is the thumb side. I'm going to palpate till I feel it, and I'm going to count for 30 seconds. Then after I do that, I'm going to come find my brachial, which you can find it here or up here, but the easy place is down here in the crook of the elbow. And the same thing, I'm going to count for 30 seconds and report my findings. Then I'm going to come up here to the carotid, which is going to be, turn your head for me please. On the jaw side right here, you're going to put your fingers right about here, and you should feel a nice pulsating strength underneath your fingertips. And again, count it for 30 seconds and report your findings. After I found my pulses, then I'm going to define systole. Systole is when the heart is contracting. Diastole is when the heart is relaxing. Normal blood pressure for an adult is 100 to 140 millimeters of mercury. Diastole is 60 to 90 millimeters of mercury. For a child, we're going to use the formula 70 plus 2 times the age to 90 plus 2 times the age. That's your parameter. Anything below 70 millimeters of mercury is just too low for a child. Now I'm going to find my blood pressure cuff, and I'm going to apply it to the patient. First of all, you're going to make sure that the arrow pointing down here is in line with the actual artery that you're using. We're using her left arm, so I'm going to make sure that this comes around her arm at least 1 inch above the antecubital fossa, which is the bend in the elbow, and I'm going to secure it so it's tight enough not to slip off. I will move my sphygmomanometer up here so I can actually see it. Then I'm going to find her pulse, take my bulb, tighten up my control valve, feel for the pulse, and I'm going to keep pumping until I can't feel her pulse anymore. Once I can't feel her pulse, I'm going to pump one more time for 10 millimeters of mercury above, and I'm going to open it. I have a palpated blood pressure of about 70. So now that I know that for my auscultated, making sure your binaurals are heading forward or your earpiece is heading forward, you're going to put this in your ears. Put it over your brachial artery, which is the inner part of the bend of the arm. So I already know it's 70 pal, so I'm going to pump it up to at least 70. I'll probably take hers up to about 120, 130. And as I open it, once I hear the bottom number, that was 102 over 62. Then I'm going to take this off and set this aside. Now I'm going to listen to lung sounds. Okay, we want to get at least 6 sets of lung sounds, or 6 places I should say. So I'm going to put my binaurals back in my ear, have my person sit up and lean forward, and I'm going to listen to 6 spots on the front, having her breathe out through her mouth. Deep breath in, please. Open through your mouth, please. And again. And out. And to the right. And out. And left. And out. And one more. And out. Perfect. And out. Okay. Go ahead and stand up for me, please. And turn around. Moving her hair out of the way so you guys can see. I'm going to listen to 6 spots on the back side too. Deep breath in and out. 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 Good. Go ahead and have a seat for me. I will report my findings as clear. I am listening for ventageous breath sounds. Advantageous is normal, ventageous is abnormal. You would want to listen for rales, crackles, bronchi, and stridor. Stridor is the high pitch from the larynx box up that kind of has that crow sound to it, that that's found up here. Then you would have, going down, you would have wheezes, which is usually in the uppers. You can feel it in the lowers too. It's the constriction of the bronchioles that you have this kind of as you're exhaling. Bronchi is in the tree, in the trunk, so it's in the bronchus, the main stem, right and left bronchus, and it's the mucus sounding because the mucus can't get out of it. And then you have crackles, which is in the bases, and that's the fluid. When the water goes through it, it kind of bubbles or percolates through. So those are all abnormal findings. I am assessing for rate, rhythm, and quality on both my pulse and my respiratory rate. Rate is it fast or is it slow? Rhythm is it regular or irregular? And quality is it weak or is it strong? After I'm done with assessing my patient, I would take my cleaning wipes and I would clean my equipment. And to do so, I would just take an alcohol pad, and the first thing I would make sure to do is to clean my earbuds and let it dry, and then also my bell right here, and then I would wipe the inside of my blood pressure cuff and let it dry. And do this too. Then I would take my gloves off like this, and I am done teaching the skill.